All right, hi, Danny, student nurse here. Today I'm going to be placing an NG into my patient. The purpose of the NG today is for decompression. We got a bowel obstruction. We want to remove contents from the stomach to help give some relief, which is different from your enteral feeding or feeding tube, where you're going to be placing the feedings into the stomach. There is a little bit of if it's just enteral feeding, sometimes we'll use a little bit of a thinner tube that's weighted to help keep it in place more. The NG tube also has this blue pigtail, and what that's used for is for during suction. This comes out so that way air can get in, and it helps keep the end from sticking to the lining. So that's kind of the difference between those. So when I come in, I'm going to introduce myself, identify my patient, wash my hands. And at this time, I'm just going to be going over the procedure with my patient. I'm really not going to have my materials because it is can be intimidating. So I'm going to let him know that we're going to be putting this tube in. It's going to go in through the nose and go down the throat into the stomach. I'm going to forewarn him that it's not going to be pleasant. It's not going to be comfortable. There is a potential for a little bit of a nosebleed. But with that discomfort, there are things we can do, such as using a lozenge or a spray to help with that. And I'd explain some of the things that he can do to help me, such as like when I initially put it in, we'll kind of have the head tilted back just a little bit. And then once I get it in, I'm going to hand him a glass of water, and I'm going to ask him to put his chin to his chest and start drinking. As he's drinking, I'll start inserting, so I'll explain all that to my patient. I'll ask if they've had any serious nose trauma, deviated septum, anything that might interfere with me getting that tube in. So then I'd get my supplies and everything ready for, and I would also have to get a consent with this. And then our doctor's orders are for the NG at an intermittent suction as well. So to kind of prep myself and get started, I'm going to tear off some tape here, approximately 4 inches. The purpose of this tape that I'm tearing off is going to be to secure my tubing to the bridge of the nose to help keep it from dislodging and moving. So that way the tube stays in place in the stomach where we want it. So I'm going to tear this approximately halfway down, and I'm just going to set that here. I also have some tape where I will be marking my tube so I know how far to go in. If my patient needs tissue, I've got tissue handy. Got a Chucks or a towel or something will be on the patient, help keep them clean during the procedure. It's not going to stay on there, so I'm going to use it as my clean cloth for my material down here. So what I'm going to do now is I'm going to inspect the nares. I'm going to ask him to just tilt his head back so I can look inside, see if I can see any sort of issue as far as obstruction or anything. And he does have kind of a crooked nose, so there might be a little resistance. So now what I want to do is glove up. That's what I want to do. So I'm going to put on clean gloves. Gloves are not my friend. All right. So I've got my gloves on. Now, in order to know how far I'm going to put the tube in, I need to measure. And I'm going to go from the bridge of his nose to the earlobe and then down to the xiphoid process. So I got it from the tip of the nose to the earlobe And I'm gonna say right about 50. So this is gonna be my marker at that 50. I'm just gonna wrap it around and just kind of pigtail it like that, so it's still easy to grasp onto. I've got my water for when I need him to start drinking. I've got my lubricant here. So our lubricant that we're using today is just a soap and water mixture. Depending on your facility, you'll use whatever whatever their protocol is as far as lubricant goes. So what we want to do is really get it in there so that way it slides nice and easy, or easier. Okay. So now that I got this kind of lubricated, okay, I'm gonna stand up for this one. So I would have him kind of tilt his head back a little bit. This mannequin keeps trying to fall every time I do that. So at this point, okay, I'm gonna insert it. So we're gonna have our head back a little bit, and then I'm gonna hand you your drink, and I want you to put your chin to your chest, and I want you to start drinking. And as you're drinking, I'm gonna start advancing until I get to that tape. So I'm gonna go in a little bit. At this point, hand him the drink. Okay, now put your chin to your chest. He puts his chin to his chest. He begins drinking, and I'm going to advance. All right. All right, so I got it to my tape, approximately. So as I'm doing this, had I met resistance where it's not really going down, I'd stop, I'd kind of gently pull back, try to advance again. If that's not working, one of the things I can do is, with pen light handy, look in the mouth and seeing if it's getting coiled up in the back of the throat. So from here, I've got it hopefully in the stomach, and so now we need to verify. All right, and it's kind of wanting to fall out on me, so I'm just gonna hold this here. And then to verify, and I am getting some stomach acid right there. All right. All right, so I got this container here. I pour it in here. I've got my pH strip. I'm gonna dip that in. I want it approximately 1.5 to 4 for my pH. That's indicating that I'm in the stomach. All right, and then I'm gonna draw it back, get approximately 30 milliliters of air. Grab my stethoscope here. I'm going to place my stethoscope on the abdomen. And I'm going to be listening for a whooshing sound. Okay. So between that pH and the whooshing sound, I'm pretty sure I'm in the right spot. I'm also going to have an order for x-ray to come and take a picture to verify the location. Had I not had gotten return with the stomach acid, I might try and advance it another couple of inches and retry again. So at this point, the part that I did not rip is going to go on the bridge of the nose. And these go down the tube. All right, so that hopefully is going to secure it to his nose to help keep it from going out. One of the other things that I need to do yet is I'm going to take another piece of tape here. And I'm going to secure this tape around the tube and pin it to his shirt, ensuring that he's able to move his head without pulling that NG. Alright, so if I pinned it there, he's got slack, should be able to move his head. All right, so from here, disconnect this. I got my tubing that's gonna go to my suction on intermittent. Got the little connector piece. That's gonna go into the main tube, not into the pigtail. You wanna make sure that blue pigtail stays open so that way we're not helping to prevent adhering to the stomach. So at this point, I'm also gonna talk with my patient, ask how it's being tolerated at the moment. It's probably not gonna be comfortable. Reassure him about the lozenges and the sprays that can help with that suction on, see if it's giving relief at all. Sometimes they can get some immediate relief, sometimes it might take a little bit longer. So, and then at this point, I'm going to clean up and I'm gonna document, so yeah, I have it on intermittent suction. Another thing that can happen is we can get breakdown of the skin around those nares. And so we're gonna wanna keep an eye on that. If we do get return, we're gonna wanna document the COCA, we're gonna amount, color, odor, consistency, I feel like I'm forgetting something. So yeah, so when I'm charting, I'll chart the COCA and the amount. I'll mark the distance. I'll make sure that so I know how much is hanging out for placement to ensure that it hasn't been misplaced. Oh man, we're falling. I think that's